Hi, my name is Ruarache Martha Madziwa, and I'm a final year pharmacy student at Rose University. I hope you enjoy and learn from my article based on an antimicrobial stewardship article I read. I will tell you the name of the article shortly.
Esprit de Corps.
Esprit de Corps is a French term referring to a shared spirit of comradeship, enthusiasm, devotion to a cause among the members of a group. In this context, the cause is antimicrobial stewardship. The article we're going to be looking at is called Esprit de Corps towards collaborative integration of pharmacists and nurses into antimicrobial stewardship programs in South Africa. Before we go any further, let's talk about antimicrobial stewardship. Antimicrobial stewardship is a coordinated program that promotes appropriate use of antimicrobials, improves patient outcomes, reduces microbial resistance, and reduces the spread of infections caused by multiple resistant organisms. Antimicrobial resistance is your biggest nightmare. The worldwide spread of antimicrobial resistance has been labeled a global crisis, and it is estimated that by 2050, 10 million lives a year will be lost due to antimicrobial resistance. What is South Africa doing about this? Well, it will be nice for South Africans to have an expensive antimicrobial stewardship program with medical microbiologists and infectious disease specialists. Unfortunately, South Africa is a developing country, and so are the rest of the countries in Africa. There are not enough resources to go around. Available data on antimicrobial stewardship programs in South Africa are scarce, and the ones out there are not relatable to the African context. We need an alternative antimicrobial stewardship model that uses available organizational infrastructures, which are the basic frameworks with which clinical care is delivered and supported, and not dependent on or driven by clinical microbiologists and infectious disease specialists.
Esprit de Corps.
This article encourages us to use the basic resources we have by collaborating members of the multidisciplinary healthcare team, the pharmacist, and the nurse. Because the pharmacist and the nurse spend so much time together, they are placed in an ideal position to redirect healthcare towards improved patient outcomes.
In this article, it gives us examples of local studies done in South Africa using different interventions that show the collaboration of pharmacists and nurses is essential to antimicrobial stewardship programs. The pharmacist's role is to ensure optimal use of antimicrobials. There are different types of antimicrobial management interventions. In this study, a prospective audit and feedback method was used at 47 Netcare hospitals. This is a method where the pharmacist does patient-specific reviews, or you can say audits, of inpatients on antibiotics and then gives recommendations to the prescriber if any changes need to be done to ensure the appropriateness of the antimicrobial therapy. The results which came out of the study was an overall antibiotic consumption reduction of 18.1% in 116,662 patients. Pharmacists are an absolutely essential role in antimicrobial stewardship interventions. This study's intervention was improved compliance with 4 operative antibiotic measures, which are antibiotic choice, dose, duration, and timing. Perioperative antibiotic measures were created because of the recognition of proper antibiotic prophylaxis in preventative surgical site infections. This study was done at 34 private South African hospitals. Theatre, anesthetic, and surgical ward registered nurses assisted the intervention in significantly improving compliance with the timely administration of antibiotics before surgery. and the results were as follows. There was a 19.7% reduction in the surgical site infections of 24,206 surgical cases. Definitely, we need nurses in our antimicrobial stewardship programs. We really need to remove the idea that antimicrobial stewardship is outside the scope of nursing responsibility and expertise. In this study, the collaboration of the pharmacist and the nurse in antimicrobial stewardship is illustrated. The intervention was improvement in hang time compliance. Hang time is the time from which physician orders the antimicrobial to the time the nurse actually hangs the IV antimicrobials. The sequence is usually physician orders, nurse gives order to pharmacist, pharmacist prepares order, and nurse collects and administers the antimicrobial. It has been reported that if an antimicrobial dose is delayed, there is a high mortality rate as compared to when it is not. The study was done at 33 Netcare hospitals. The goal was to administer the antibiotic in 1 hour. The improvement in hang time compliance in 32,985 patients was very significant. Pharmacists and nurses are crucial because they're like the rate determining step in the antimicrobial administration equation, and the doctors are the fast process. They need to work together. I did my externship at a hospital in Zimbabwe called Avenues Clinic. It is a private hospital. Since all these studies were done at private hospitals, this paper is relevant to where I worked. The hang time strategy, the patient review and consultation strategy, and peri-operative strategy can be incorporated where I work. Us pharmacists are not there when these antimicrobials are being administered. And as a pharmacist, it is our duty to install awareness in nurses, train them, and motivate them to take action when dealing with antimicrobials. And it is through continuous interaction and involvement in antimicrobial stewardship programs we can change the attitude towards antimicrobials amongst our health care professionals. There were gaps in these studies. These studies were done in private hospital, but most antimicrobials are being used in the public sector, and that's where majority of our patients are, and this is where we are mostly needed. The question is, are there enough nurses and pharmacists to incorporate these strategies? So, there's a need for more research to be done about antimicrobial stewardship in the public hospitals. And this is where the pharmacist and the nurse can also come in and help out with antimicrobial stewardship. It is up to us to do with what we have and to also educate ourselves further about antimicrobial stewardship. And it is also up to the education that we as pharmacists and nurses receive, because a study has been done and has shown that the pharmacy curriculum varies amongst the South African schools, and is antimicrobial stewardship being incorporated? It is an essential tool to make a difference globally. And I'm glad I had the opportunity to do this. I hope you took something out of this.